All right, good morning, everybody. It's Christian, Advanced Medical Testing. Today, we're going to be starting a discussion about our retail panel, the essential vitamins and minerals. Now, we all know that essential vitamins and minerals looks like a pretty cool test, and it really is a pretty cool test, but we don't probably ever consider about how important vitamins and minerals are in our bodies. We're told to get our vitamins and minerals from our foods and take these supplements, and everything's going to work out. So let's talk about, first off, who needs this panel and why. Pretty much everybody needs this panel. We all know about the labels on our bottles of food and all of our food packaging that says recommended daily allowance of this vitamin or this mineral is this percentage. The problem with that is the recommended daily allowance is an antiquated system, and it's not designed to address our specific needs based on our genetic makeup. The RDA has been changed several years. It's basically the government saying this is what we think. Now, you would assume that it's backed up with science, but actually a lot of the scientific experts out there, nutritionists, disagree with the recommended daily allowances. For example, if it tells you need so many milligrams of this or that, it may not be what you need at all. So everybody needs this panel. Now, the right amount of absorbed vitamins and minerals are crucial to stay alive. Notice absorbed vitamins and minerals. Right now, if you took a blood test, you might pop up and have plenty of vitamin B in your blood, but your body may not be absorbing that. So it's not what's in your blood, it's what gets to your cells. Right now, our foods are processed more than they ever have been. They're not as nutritional as they were even a year ago. As a matter of fact, the United States is ranked 35 in healthiest countries out of 169. 35. The obesity charts were towards the top. The unwell charts were closer to the top than we are the bottom. So we're higher in ranking in the bad categories than we are in the good ones for sure. Reason being, a couple different reasons. Our environment's full of toxins, and our modern farming methods have stripped the soil pretty much of all the nutrients. As a matter of fact, between 1978 and 1991, we've seen an over 57% loss of the nutrients in our foods that are farmed. Used to be the saying, an apple a day keeps the doctor away. Well, now to get that equivalent of that one apple, we'd have to eat probably 25 apples when they made that saying. Another person that needs this panel, besides everyone, of course, is people that are on supplements. Supplements can be very expensive, and as a matter of fact, that's what this panel addresses, is going to be the need for supplements, if there is one. First off, what's a vitamin? Well, the dictionary says a vitamin is a group of organic compounds which are essential for normal growth and nutrition and are required in small quantities in the diet, because they cannot be synthesized in the body. In a mineral, it's a solid inorganic substance of natural occurrence. So if you think of it like this, the vitamins are very important to our body because they fuel the processes which occur chemically in our bodies to convert what we bring in our faces into energy and get those nutrients that we need from our blood into our cells. They help with all of that. But a mineral, think of this as just a building material. Our bodies cannot manufacture minerals. Okay? Our bodies can synthesize vitamins, but they cannot manufacture minerals. Two types of vitamins out there, water-soluble and fat-soluble. The technical term or scientific term for water-soluble is lipophobic, and fat is lipophilic. Probably won't see that word too often. Some of the water-soluble vitamins that are required for our bodies are B1, 2, 3, 5, 6, 8, 9, 12, and vitamin C. Now, it doesn't matter how many of these vitamins we take. You can take them by the bottle full, and a lot of people do. But the vitamins will, if we don't use them, you lose them. They go right out of our systems. Fat-soluble vitamins include vitamin A, D, E, and K. And they're fat-soluble, so that means they can be stored in our body. Now, you can take all the vitamin B you want and vitamin C you want, take it by the bucketful, and you're not going to hurt yourself because what your body doesn't use, like I said, is going to be expelled in our urine. But if you take too much vitamin A, vitamin D, Vitamin E and vitamin K, you can actually become toxic, and toxins can turn into cancer. So yes, if you take too many vitamins, you can cause cancer. Minerals, again, they're the building materials of our body. They are used to build our bones, our tissues, and muscles. Here's a myth. Our body will only take what it needs when you're taking vitamins. That's a myth. The fact is genetic weakness affects our nutrient delivery systems. Now, in the previous panels, you've heard me use the word methylation quite a bit. Methylation, methylation, methylation. Reason being is because impaired methylation can lead to depression, anxiety, histamine intolerance, increased risk of cancer, hormone imbalances, poor detoxification capacity, infertility, birth defects, fatigue, and low energy. Methylation, though, what does it actually mean? Well, methylation is just the way that our body converts materials, and it assists our bodies to convert those materials into something useful. Now, methylation is a key and catchphrase this year, right? And it seems like it's a new thing they just found out about, but actually the scientists have been discussing methylation for over 15 years. They're just now putting the focus of the light on it. Now, typically in my panel series here, we go over, the covered SNPs, but I captured this slide from a previous presentation. This is a couple of the SNPs that we're going to look at for this test, the VDR-TAC and the GC or DBP. Now, they're both vitamin D receptors and binding receptors. Now, this is the definition. The vitamin D receptor handles bone growth by absorbing calcium so you don't get osteoporosis. Also affects our nervous system, which is the ability to send and receive messages through our nerves, and also to fight off bacteria and viruses. I just threw this up there quickly because what I decided to do with this panel is to show you what happens if you are lacking vitamin D. Okay, some serious side effects. So this is the SNPs that the Essential Vitamins panel covers. Again, that VDR-TAC1 and the GC, also known as the DBP, refers to those vitamin D receptors. Here's what can happen if you are not absorbing enough vitamin D. You're going to get sick more often. You'll have fatigue, bone and back pain, muscle pain, depression, bone loss, hair loss, and believe it or not, impaired wound healing. The next SNP that we're going to look at is the TCN2, and that is the one that deals with the methylation of that vitamin B12. And if you don't have enough B12 in your system, this is what can happen. You can get anemia. You can have permanent brain damage, permanent cognition issues, like you could have permanent amnesia for long-term memory. You can also get stomach cancer and pass those defects on to the children, birth defects. The BCOM1, that's going to be the SNP that's going to be dealing with vitamin A. Without vitamin A, you can become blind, or at the minimum, get night blindness. And you can even die from infection and diseases if you don't have enough vitamin A in your body. But one of the more less serious side effects in the short term is diarrhea. So if you've got some unexplained loose bowels, one of the things that you can look at is to see if you're getting enough vitamin A. The CoQ2, the CoQ2, that actually helps produce something that you've all probably heard of, the CoQ10. I mean, they sell it in bottles, and people think they're taking it because they may have low energy. All right, so if you don't have enough CoQ10 in your body, not only can you have low energy, but you can actually get heart disease, have brain disorders, can catch a little bit of diabetes, and also some cancers. Now, what CoQ10 actually deals with here is the cellular energy that your body needs. So when we're talking about energy, we're not talking about that just get up and your oomph in the morning with that, what you feel when you take a shot of sugar or a cup of coffee with whatever. What we're talking about here is the energy at the cellular level. Now, of all the food that you bring in your body, all the nutrients that gets converted, your brain is going to use up the majority of that energy. It's going to use about 40%. of the energy that we produce. 20% will be used in your muscles. Another 20% is going to be used in your immune system. And then the rest of the body will require that 20%. What they've also recently discovered is that CoQ10 is good, but start looking out for this one to be on the shelves if it's not already. PQQ. It's CoQ10, but it's a more potent form. So some doctors may say to a patient, you need to take some CoQ10, and some may say, well, I think we're going to try you with some PQQ. It's just more potent, CoQ10. The SLC23A1, that deals with vitamin C, and without vitamin C in your body, enough of it, you can get glaucoma, something that's rare, but it still happens, scurvy, more common gingivitis, fatigue, depression, impaired wound healing, and internal bleeding. The SLC30A8, that's going to be dealing with the mineral zinc, and we can't produce zinc. We do have to ingest it. So without zinc in your body, you can deal with diabetes and macular degeneration. And if you don't know what macular degeneration is, it's an incurable form of blindness, vision loss. It's incurable. Once it starts, it's over. Nothing you can do about it. Next one we're going to talk about is the SLC5A6. That's going to deal with vitamins B5 and B7. If you're lacking in those, it's going to explain why there's hair loss, or brittle nails, skin rashes, and tingling in your fingers and toes. Last but not least, the TTPA, that's going to be dealing with vitamin E. And vitamin E is very important for our muscles and our nervous system. All right. Before we get into the report, let's go ahead and talk about minerals real quick. The most important minerals that our body are going to need to bring in is going to be zinc, calcium, and magnesium. Okay? So this is one of those things where if you don't bring in enough, it's going to be bad for you. But the other hand is if you bring in too much, that can also be bad for you. And just like anything else in excess can cause toxins, and toxicity can lead to cancers. So a lot of people will have some of these symptoms, and they're going to go to their doctor, and they're going to find out, the doctor will tell them, well, take a multivitamin. You know, take a multivitamin, take a one a day, take a whatever they're going to tell you to do. But without looking at your DNA makeup, you know, they may be giving you a disservice there. Pharmacists know way more about supplements and medications than doctors ever will. So the person that people should consult when it comes to their supplemental needs is not their doctor. It's their pharmacist. Now, one of the other things that's a catchphrase out there is probiotics. Okay? You guys have seen that, those commercials with Jamie Lee Curtis, Activia, and all those kinds of things. I think we've talked about this before, and it is important to have probiotics in your body because that's going to give you a healthy gut. They call the gut the second brain, and it regulates a lot of things in our bodies. But here's another thing I told you is that just as important as a probiotic is a prebiotic, which is the food that the probiotics need to eat in order to produce that good bacteria. But here's something that will probably surprise you, as it did me when I learned about it. If I take a probiotic in a pill form and I swallow it with water that's been treated with chlorine, I have now just killed all the probiotics that I just put in my mouth. So a lot of the bottled waters out there, you got to be careful, especially if they're chlorinated. Okay. So of all the vitamins, which is the most important? You know, you may run into people that want to have that discussion. Well, one thing that I use as an analogy when I'm talking about vitamins of which one's the most important and which one's least important, I guess I could ask you a question. When you're making spaghetti sauce, what's the most important ingredient? Well, some of you might say tomatoes. Some might say something else. But really, the problem is that without any of the ingredients that you use in a recipe to make what you're making, if you're lacking that ingredient, that becomes the most important. So there's not really one vitamin that's the most important. Keep that in mind. So this is going to be a briefer training panel, and so we're going to get right into the report here. Looks like the rest, right? So basically, it's going to be just what we talked about, all those SNPs, and if they're deficient in the production of those vitamins, then that's going to be the treatment for therapies, is giving them the vitamins. So we're not going to go through every SNP like we do usually, because that report is pretty much a self-explanatory report of all of our reports. It's important that the doctors can go over that with their patients. But this is one where a patient can actually take a look at it and see the recommendations and almost, I say almost, not worry about running to the doctor right away. But you can see here with the SNPs, they're telling you if you're deficient in this vitamin, take that vitamin. Okay. And again, with all of our reports, they all say the same thing, right? They've got the areas. They've got the highly recommended therapies. They've got the lifestyle recommendations. And then they've got the further laboratory recommendations. Now you'll notice that up here it says laboratory recommendations, consider routine vitamin A level checking. Consider routine vitamin B level checking. They're not really talking about getting regular blood tests for these things. Because if you test your blood, like we talked about at the beginning, and you have tons of vitamin B, that does not mean that that vitamin B is getting to where it needs to go. Same with vitamin D. Vitamin D, again, we talked about this in a previous panel. It's so very important. But if you're not absorbing the vitamin D, it's not going to do you any good to just take more and more and more. They've got to isolate the problem, see where the system's breaking down. All right. And with the report comes the gene chart and also some definitions here for the patient and the doctor. That is, in a nutshell, the Essential Vitamins and Minerals panel. Again, who needs it? Everyone. Okay. So I'm going to go ahead